We all know that kidney is known to be the major organ for homeostasis of the body. It performs various functions, and sometimes most of them, or maybe all of them, are affected due to kidney failure. Now let us have a look on how every single function of the kidney contributes to homeostasis and how their disturbances will cause imbalance of the body. So just as a refresher, there are 7 basic functions of the kidney. First up, we have salt and water hemostasis, blood pressure control, removals of toxins from the body. Kidney even functions to maintain calcium and phosphate balance, erythropoietin production, potassium balance, and is even responsible for acid-base balance in the body. Now we will look at how these functions are regulated normally and how they will be presented in the case of a chronic kidney disease patient. So, salt and water homeostasis. This occurs via filtering and partially reabsorbing the water and salts from the body by the kidney. Now, when this normal function is disturbed in the case of kidney failure, in some cases we may observe fluid overload, which may present as peripheral edema or pulmonary edema. And in other cases, it may also result in fluid depletion. So do remember that both things are happening in different cases. In some cases, there's fluid overload, and in other cases, there's fluid depletion in the body. Now, the treatment usually involves the administration of diuretics, and in extreme cases, dialysis may also be done. Now, coming towards blood pressure control by the kidney. This occurs via the secretion of renin that regulates the renin-angiotensin activation system through the juxtaglomerular apparatus. And now when this will be disturbed, this will, in the case of chronic kidney disease, obviously, this will result in hypertension. And if we talk about the treatment, it can be treated by giving antihypertensives. And obviously, in extreme conditions, we again have dialysis. So the removal of toxins by the kidneys is done in 3 ways. First up, the filtration occurs via glomeruli. There's passive diffusion, and toxins are actually excreted from urine through the kidney. Now, if this is disturbed in the case of kidney failure, this may result in uremia, which means that all these toxins and the filtration will be disturbed and these toxins will accumulate in the blood. And if you recall, in the previous section, we told you that uremia results in encephalopathy, pericarditis, nausea, vomiting, high cough, and even the bleeding tendency increases. And we may also observe neuropathy in these patients. Now, if we talk about treatment, it involves dialysis and the administration of desmopressin. So like I told you earlier, that calcium and phosphate balance is maintained by the kidney. So now you must be wondering, how does it do so? Well, calcium is normally absorbed while phosphate is excreted out of the body. So keep this in your mind, because when this function is disturbed, the phosphate which was normally excreted will now be present in the blood in a higher concentration, leading to hyperphosphatemia. And the calcium which was normally reabsorbed in the body will now be excreted out of the kidneys, resulting in hypocalcemia. Now, this disturbance in the calcium phosphate balance may also lead to renal bone disease and tertiary hyperparathyroidism. If we talk about the treatment, we have to reduce the phosphate diet of the patient and administer phosphate binders. We may also administer 1-alpha-hydroxyvitamin D or cholecalciferol. And in the case of tertiary hyperparathyroidism, we may have to perform a parathyroidectomy. Erythropoietin is secreted by the kidney in response to cellular hypoxia. Remember that erythropoietin maintains and regulates the production of blood cells in the body. So in the case of kidney failure, this may lead to anemia in the patient. And treatment just mainly involves the administration of erythropoietin. The kidney is also responsible for potassium balance. It does so by filtering and partially reabsorbing potassium from the body. And when this balance is disturbed in the case of a kidney failure, this will lead to hyperkalemia. And obviously, the treatment involves potassium diet restriction, and in severe cases, dialysis may also be performed. So our kidneys are also responsible for maintaining the acid-base balance in the body. But how does it do so? Well, normally it reabsorbs the bicarbonate ions and secretes the hydrogen ions. And obviously, the disturbance in this acid-base balance will lead to metabolic acidosis. The treatment mainly involves the administration of sodium bicarbonate, and obviously in extreme conditions or in severe cases, we perform dialysis. So we have just discussed the normal function of the kidneys and the possible treatments if those functions are disturbed, obviously in the case of chronic kidney failure. Now, but you must keep in mind that if these functions are disturbed for a long period of time, these treatments might not be helpful enough. And the patient will sadly have to be directed towards either dialysis or a transplant may also be done in these patients. We also call a transplant renal replacement therapy. So keep watching ahead as we discuss the different stages of chronic kidney disease and what treatment to administer at each stage.